Okay. Welcome, everyone. Thanks for joining me on this Sunday evening. I know a lot of you probably have some exams to study for. It is the week of Thanksgiving, so I'm sure a lot of you guys have stuff to do. But thanks for joining me. I have the privilege of being asked to join this fresh dental shadowing, which I think is genius. I wish I had this when I was in school. It's always so hard to start shadowing different professionals in person, and so this is just awesome. And these are one of the good things that came out of COVID, I guess. We started getting more ingenious with the virtual learning. So I'm going to go through a little bit about myself, and then I'll go into Perio. I am a private practice periodontist working in Denver, Colorado. I have been affiliated with a lot of community involvement and different societies and associations. When I moved out here, I joined the Colorado Dental Association, the Metro Denver Dental Association. I've been part of the American Dental Association since dental school. I joined AAP, American Academy of Periodontology, in residency. And they have a lot of resources, especially for students looking into going to perio residency. And I did a lot of facial injectables and learning and anatomy courses throughout my dental school and residency career. So I've been affiliated with the American Academy of Facial Aesthetics as well as Academy of Osteointegration since dental school. So just really involved with as many societies as I can be with the free time that I have, just because it allows me to network, meet amazing people, and just be the best periodontist I can be. So what we'll discuss today is I'm going to do a little brief introduction. I'm going to go over what a periodontist is. I'll do a day in the life of a periodontist, my journey, speak about my research experience, private practice, work-life balance, and I'll go through some cases with you guys. And those will be surgical videos, so I implore you to stay throughout this whole thing to enjoy those. And then I'll take questions at the end. So my education, I went to Florida Southern College for my college degree. I got a Bachelor of Science in Biochemistry and Molecular Biology and a minor in Spanish. This was in Lakeland, Florida. I was maybe an hour and a half from my parents. So it was super nice to be able to go back home on the weekend. And they had a really strong biology program. So I enjoyed the small classes, the small town kind of feel. I did not want to go to a huge college, so this was perfect for me. And I was able to not have too many loans out of school because they did give a lot of financial help. So this kind of set me up in a really nice, this is something you have to consider if you're going to a school that's really expensive. And then later on, you do want to do professional school. It adds up very quickly. Then I went to Nova Southeastern University for dental school. I received my Doctor of Dental Medicine there in 2018. I was a Chancellor Scholar. This is a scholarship that's given to students that show a need for financial help, and definitely helped me with tuition there, because dental school can be really expensive as well. I believe our tuition was about $70,000 a year, and that can vary between state schools and private colleges. So that's definitely something to consider if you're planning to apply for dental school. And then I went to Boston University for my residency, my periodontology degree. I got it there. I also did a master's degree, which is not required, but it was already part of our program and they integrated it very nicely. So I decided to take advantage of that. And that was a 3-year program from 2018 to 2021. I was chief resident for 3 years. I had 6 amazing co-residents, and I was privileged to be able to lead them through the 3 years. It was a lot of fun. We were a small family in Boston. And I was a Zanny Scholar, which is a scholarship, a merit-based scholarship they give to one resident. This is a half tuition scholarship. So this also helped me with, focusing more on school and not so much the financial aspect. My education. So why did I go to dental school? Early on in my college career, I really wanted to incorporate manual dexterity into what I do every day. I'm a pianist, and I loved working with anything hands-on and anything that deals with meticulous detail and paying attention to, small details really kind of enticed me. And so I decided that dental school and the dental field was something that I wanted to pursue. I really wanted to help people. And I think with dentistry, you are able to do a lot of community outreach and, in your community and abroad, and really get to underserved communities through this field, which I loved. And I wanted to have clinical autonomy. This is something that I learned in school. I didn't know about this, but pursuing a profession where I can form a personal relationship with a patient and provide really high standard of care in the private sector was something that started calling my attention as I shadowed different private practice doctors, and they had a lot of clinical autonomy in their business. And so I really loved that aspect. I never thought I wanted to be a business owner any day, but there's definitely an opportunity for that in the private sector in dentistry. Applying for Perio residency. So I'm assuming a lot of you guys are in dental school and that's why you're here. If you're in college and you're interested in Perio, good for you. You're getting a super early start. I didn't get interested in Perio until my second year of dental school when I started shadowing. And I had a lot of Perio patients that I was doing phase 1 treatment for, so just, cleanings and then deep cleanings. And then I started shadowing to see what would happen to them in the second floor, which was where our Perio clinic was. So I started early just to kind of follow up with them. And it started interesting me at every appointment I went and shadowed. All the surgeries, follow-ups, and the thorough care they gave my patients, the Perio residents, was really helpful for me to understand that Perio goes so much more beyond just what you do in dental school, which is mostly SRPs. You should definitely ask for strong recommendation letters. This was extremely important for me because I had really good mentors and I really was set on Perio my third and fourth year. So my letter of recommendations were from various professors that I work with throughout my cases. You should be able to ace your Perio classes, of course, if you're interested in Perio. This should not be something that is going to hold you back, but it is always good to have an A in these classes. And you have Perio classes almost every year as a dental student. So it's multiple classes you can show that you're interested in Perio. TOEFL, definitely you have to take this and do well. This is probably the only scored exam. I know the NBD moved to pass fail, so that's not, it's not great and it's not awful. It's not great because now you don't have a numeric number to kind of set put yourself apart in your application. But this is for foreign trained dentists only. So if you're a foreign trained dentist, you may want to do really well on this English exam. And research helps during dental school. It is not required. I was a research assistant. I did zero research. I just helped. And I really just helped with slides and helping the Perio resident get his presentation together. But I did no research that was too intense, like lab research. So I love this analogy of the iceberg because you guys may sit here and look at, these professional pictures and see a successful person, but it was really difficult to get to, any specialty position. It takes a lot of persistence. I went through a few failures, a lot of sacrifice. You have to form good habits and be able to have a strong mind because you have to be able to adapt as well as you go on and things may happen in your journey. You have to be dedicated. So this is a very good analogy to what your entire road ahead lies for you. So success without fulfillment is failure because so many people chase after this quote unquote successful life. And it's not defined by them. It's inherited by society's expectations of what success looks like. And especially with social media being so involved in our daily lives now, what you see online may not be true. So make sure that you're doing this because you genuinely want to help people get better in their health, in their overall health. And I'll discuss this later on because Perio has a lot to do with overall health. And when you get there, if you don't have an inherent goal in your heart that this is what you want to do, the fulfillment won't be there and you'll be really disappointed that you work really hard to get to where you are and you are not happy. So from the very beginning, set intentions for kind of what your goal and what the aim is for your career. So what is a periodontist? Many of you might know already, in dental school, they'll teach you that periodontitis is, anything that deals with beyond gingivitis. So anything that deals with bone loss, attachment loss. So it is a dental specialty that focuses on the treatment and restoration of supporting tissues that support the teeth. So anything related to bone, the gums, the periodontal ligament. These are the three components that we need in order to keep the teeth in place and keep them healthy. So we work on the outside foundation of the teeth versus an endodontist who may work from the inside. So if you think about the analogy of a house, which I say to my patients all the time, we build the foundation for the home and the general dentist will build the actual home. So we work to make sure that this foundation is strong and that will be able to give them a long-term housing or teeth. By preventing, diagnosing, and treating gum disease, we help patients save teeth, and when we can't save them, we provide them with dental implants. So dental implant is a huge field now. A lot of professionals are placing dental implants, dentists, endodontists, oral surgeons. So we're not the only people that place dental implants, but we work really closely with other specialties to be able to achieve the most ideal implant placement. Different surgeries and procedures that incorporate periodontal health would be osteosurgery, gum grafts, bone grafts, any biopsies. We deal a lot with inflammation of the tissues, so we will do a lot of biopsies on soft tissue, dental implant placement, sinus lifts, which is a sinus bone graft to be able to create space in the sinus and place an implant, extractions, regenerative surgery with growth factors. This is a huge field now because we have such amazing array of materials at our hands, and this is a huge field that I will be talking about in a moment. We also do crown lengthening to save teeth, and we will also do extractions. So the requirement is you have to do 4 years of dental school or have an equivalent. So a foreign trained dentist will have finished dental school in their country. A good GPA, the GPA is not everything. You don't have to have the best GPA, but you should have something that goes to show you worked really hard in dental school, because residency is really demanding as well. Extracurricular activities will help, especially if you're involved with the community or any Perio societies. Strong recommendation letters, like I mentioned, these are crucial. These are the first people that the program director will call to chat about you and your application if they're interested in you. Definitely a good shadowing experience. A residency will be 3 additional years after dental school. And you're going to be treating a lot of advanced periodontal cases, becoming IV sedation certified. This is, I believe, now a requirement by CODA, which is the American accreditation society. They decide which programs become accredited. And I believe now every perio program in the country needs to have an IV sedation certification route so that all periodontists are able to provide IV sedation. Which is a really cool aspect of our specialty. We actually get to do, intravenous and sedation to make patients feel more comfortable, especially because we're doing some procedures that may be really painful and really extensive. And the master's degree is optional in residency. Like I said, mine was integrated with my residency. It made it so much easier. I didn't have to think about taking time away from clinic. They had already incorporated it. There was no difference in tuition, and they had already set out great mentorship for me. So I decided to go through my master's degree, and I don't regret it. So I'm going to just touch upon something interesting that the AAP have pulled out, and I think this is really relevant to dental students. This is something I didn't know when I was going through dental school. It was very not discussed a lot in my perio lectures. But I just want to give you guys a little science background before we get into clinical stuff. So the inflammation that I'm talking about is the body's response to injury. The first phase would be acute inflammation, so redness, swelling. All of these are signs of initial inflammation. So what we worry about is the biologic markers of inflammation, one of them being CRP, C-reactive protein, found in the blood in response to inflammation. When this increases, you have pretty much a risk factor for several chronic inflammatory diseases in your body. So inflammation begins to appear in different diseases as a common link to several, as a common link with periodontitis. So you have heart disease, arthritis, and periodontitis being the 3 most crucial diseases that will be really intertwined into their how they behave in your body. So there has been a paradigm shift in perio. A lot of what we focus on is now inflammation, systemic inflammation. And so when I have a patient that has periodontitis and I see that they have a history of heart disease or a history of diabetes, this is all going to matter in my treatment plan. Probably the biggest link out there between disease and perio is cardiovascular disease. This is really important because if we don't have a working heart, you're pretty much not, you're out of commission. So this is something that I found really interesting. So inflammation and cardiovascular disease go far beyond just inflammation. There's actually been a study that has found bacterial plaque into these heart plaques that people have atherosclerosis. They found periodontal pathogens in these lesions. And so we know that the mouth is connected to the rest of the body. We know that periodontitis does affect endothelium of the blood vessels, and this causes an increase of CRP, which puts patients at risk for a cardiovascular event. So this just reflects how intertwined perio is with your overall health. And this goes beyond just, your mouth and your teeth and you're having a beautiful smile. This goes towards you living an extra 5-10 years. So uncontrolled diabetes, uncontrolled periodontal disease, and heart disease are probably 3 of the biggest red flags that I will see, my daily practice. Other diseases that deal with chronic inflammation is arthritis, Alzheimer's disease, diabetes, and different cancers. So that was something interesting that I didn't know in dental school. Lastly, I just want to touch on this one article that they proved they can decrease the hemoglobin, HbA1c. The patients with diabetes have sugar in their blood, and basically they are controlled if they decrease that sugar content in their blood. There has been a study that shows patients can actually decrease their sugar inflammatory markers and their blood and their sugar just by controlling their perio disease. And this was mostly shown in patients with uncontrolled diabetes, so HbA1c of 9 and above. So this is something that I deal with my patients daily. And patients struggle to bring their HbA1c, but if we work closely with their physician, it's actually really nice to show them how important their teeth are to them and their overall health, and how easy it can be to control their diabetes with diet, a good perio regimen, and decreasing overall inflammation. So periodontics offers many different types of procedures. Like I had mentioned, they are very evidence-based. So there's so much research that is being published daily on these periodontal pathogens and oral systemic health. And it's really nice to educate patients because they don't have time and they don't really have a big interest in reading these articles, but we have the education to be able to explain them and translate them into words they can understand and help them kind of improve their lifestyle. So surgical dentistry is evolving, and, like I said, maybe 5-10 years ago, they didn't have the growth factors and really amazing materials that we have today to be able to perform different tasks in regenerative periodontal surgery. There's an increasing demand for periodontists. The baby boomers are getting older and they are requiring more of our help. They don't want to wear dentures anymore. A lot of these patients, have lived their entire lives with teeth. They don't want to have their teeth pulled. And so we need more periodontists to be able to help this large amount of retiring adults. There's a connection between gum disease and other health problems. I can't harp on this enough. I love directing my patients into a more nutritious and a plant-based diet. And this is all kind of, you live what you preach. And so I love sharing that aspect of my personal life with them and eating healthy. And you can help others really change the way they live. I mean, you see patients lose weight just because they started going to the dentist and they realize that, they need to control their diabetes, they need to improve their eating. So this all overall makes a periodontist, goals and kind of what I wanted for my own career. So this is kind of a day in the life of a periodontist. I start my days at 8 a.m. and most of our surgeries will start really early, especially if they are undergoing IV sedation. I will start most of the IV sedation surgeries in the morning so that patients are not hungry throughout the day. You do have to be NPO. You cannot have breakfast. So that will be kind of the beginning of the day. Then around throughout the day, we'll squeeze consultations and follow-ups and see other patients for suture removal and things like that. Make sure that they're healing well. I will review CT scans throughout my day as I get consults, and we take CT scans for patients who need implants, patients who need bone grafts, or patients who have very severe periodontal disease. I'm able to really view the defects and see which teeth are worth saving, which teeth are predictable. And all of my decisions are evidence-based. And so none of what I do is guessing. It's all, been done, been tried, been published. And it's really nice to rely on that. I take a lot of photos. I have a DSLR camera, which I got in residency and I love. So I document all of my cases. I'm able to show that to patients, their before and after. And I discuss cases with doctors. I'm constantly on the phone. I'm constantly texting other doctors, making sure that we're all on the same page. Communication is super important. And a lot of my day, I'm just writing letters to other dentists, telling them the patient came, telling them my consult, what my thoughts are for their treatment. And I would say the most fun part of my day would be when I'm doing procedures. So I love clinical dentistry. I am a clinician for sure. I am not a researcher. So I just love being around patients and doing procedures. So the blood drawing that you're seeing there, it's me collecting blood from a patient to spin their blood down and get some growth factors out of that little vial. I draw about 2 for any small given, surgery. We can draw up to 10. It really does not affect the patient's, blood content if you do it slowly, of course, and patients are anemic. We use these growth factors in surgery to increase healing time in the first 2 weeks. So any patients that might be at risk for, their wound opening, or we just need the extra growth factors to have a more successful surgery, I will do that. On the right side is just a video of me placing a bone graft into someone's sinus after a sinus lift. I go ahead and remove a tiny window of bone in the back. As you can see, the patient has no teeth. So we make a small window, we push the membrane up, and we place bone graft inside. And I do this with a plastic sterile syringe because it allows me to insert the bone a lot faster versus using a small spoon instrument. And we're able to put this is about half a cc of bone. We usually put about 3 cc's or 4 cc's total for this amount of space we need to lift. And these are some sinus lift instruments that we use to gently push and impact the bone. This will heal for about 6 months, and then we can come back and place implants. This is one of the most satisfying surgeries that I do on my daily basis. So my journey into dentistry as an undergrad, I did a lot of volunteer work and a lot of community involvement. And anytime I got free out of school, I would try to do something to kind of learn and explore more of dentistry. So in my undergrad, I had an opportunity to do an internship. This was part of my classes. I had one, I believe it was a 1 credit hour. So it was once a week, I would go to an oral surgeon and shadow for a few hours. There was no periodontist around the area, but surgical dentistry was all an interest to me. So he was amazing. He allowed me to suction. I don't believe that's allowed anymore, but back in the day, what was this, 2014, it was a lot easier to be involved in shadow and suction and do things that are more one-on-one. I attended a summer learning program. This was at the University of Florida. It was a pre-dental program, and it was really cool. I got to meet a lot of other students that were in the same boat as me and learn about dentistry. I formed a pre-professional society, and we didn't have one at the time. And so we formed, I forget what it's called. I believe it was AMS, American Medical Student Association. So this was an association just for pre-vet, pre-dental, pre-med. It was a small school, so all of those pre-professional students formed only about 30 of us. But it was a really cool experience I got to do in college. I don't think that's too common anymore because now it's getting a little more popular and a little more competitive. And I believe every school probably does have a pre-professional society, but I would say don't be afraid to start something if you don't have it, even if it's not dealing with professional school. I volunteered at a lot of free dental clinics, and and mission trips. And this picture was us doing Give Kids a Smile. This was a once a year event where we do free dentistry for little kids. And then I traveled to Nicaragua for a few mission trips. And I traveled to Bermuda for a research trip with my undergrad. So I was always trying to, build my resume and kind of explore different areas of my field of interest. I'd never really liked research, but this research trip was really neat. We got to study lizards in an island. And so that was something different that I got to do in a really fun island. And I got to meet a lot of really nice people there. So don't always be super focused. You can branch out and have something very different and interesting in your resume. Like we got to publish this article when I went to Bermuda about lizard behavior and how they migrated to that island. Totally different than what I'm doing now, but it definitely gives you something to talk about in an interview. And this is just pictures of our mission trip. And this is the group of students that went to that summer learning program. I believe all of them have graduated dental school by now. We were all different stages of school. So it's really neat to see other people kind of grow in the field. Throughout dental school, I knew I liked surgical dentistry. So I did shadow the Perio department a lot. I did do a lot of mission trips because I got to give back to the community, have fun, and also, get better at my surgical skills. I think that was my first extraction there. On the lower right, I went to Jamaica, Nicaragua for 2 mission trips. The guy that you see in the upper left hand giving a cleaning is my husband now. So I met him in dental school, which is so funny. It was really hot in all of these places we went to. So we'd crowd around the AC unit and try to get some air. There were long days, like 8-10 plus hours of working in the heat, but it was super rewarding and so much fun. And you just feel like a different person when you get back. You just feel so appreciative of just having AC and running water. I was president of the Student Society of Periodontics in dental school. That was also really fun. I got to organize a few events like Impressions Day. I did go to a lot of meetings to be able to really immerse myself in the field of perio and surgery in general. So the Academy of Osseointegration was a really neat meeting. Got to sit in lectures. I had no idea what they were saying, but it was really cool to just watch these masters of their craft just talk about their surgeries, and AAP as well as a great meeting. I volunteered at a nursing home giving oral hygiene instructions, which was all the nurses really appreciated because we know a lot more about dental health than a lot of medical professionals. And so this was a really neat thing that I got to do. My residency journey was a lot of fun too. I got married, planned a wedding in residency, which was a little bit difficult because residency is very busy. You're in classes, you're in clinic and taking exams. It's just like dental school. And I participated in research. My first year, I studied CT scans. I'll talk about my research here in a bit. And I was chief resident for 3 years. I trained with implant robotics. So the lower left thing, do you see? It's called Yomi. It's an implant robot. It basically guides your handpiece into place. You guide the handpiece into place to place an implant. You pre-plan the implant, so it's really hard to deviate from the plan, and it's very safe and it's very accurate. It's probably the most accurate way to place an implant in today's world. So I was really lucky to be able to train with that really fine piece of equipment in residency. I worked part-time during residency because I was able to get my license, and I had the free time on the weekends. So I kind of managed my time in order to be able to pay some bills. And I volunteered at a clinic that was a lot of fun as well. This is called Freedom Clinic. It was in Florida. I volunteered with the University of Florida dental students, and we did everything: cleanings, extractions. They were doing, free dental work and dentures. Prosthodontist came and donated about 10 dentures to patients. He would bring them to his office and do it for them, which was really nice. So that was really fun to do during residency as well. Part of my research in residency was dealing with viewing CT scans. So I viewed about 400 CT scans, and I came up with a classification system for immediate implant placement. and roots of teeth. This is very in-depth for an introductory lecture, so I'm not going to go through the specifics of my research, but it was really interesting and fun to dive into the world of immediate implants. Basically, when you remove a tooth and place an implant the same day, it's very predictable if done well. And I got to view a lot of CT scans and train my eye with this specific imaging that you are not trained with in dental school. And I implore a lot of you, if you're doing endo or perio, viewing a CT scan is the way you diagnose. So getting really good at that is so important because you're going to be doing that every single day. I also do a lot of clinical application of Botox and dermal fillers, and I do this in comprehensive treatments. So it was really neat to be able to present this at the AO meeting last year and at the Tri-School meeting, which was us, New York University, and I believe it was Tufts. It was a local tri-school. So I got to present this kind of, I did a presentation. This is a poster about this patient that we treated comprehensively. We fixed some of her recession, we placed an implant, and we did some Botox and fillers to be able to fix the asymmetric smile that she had. So currently working in private practice at Denver Periodontics and Implant Dentistry. I started work here in September, and I'm very happy. I interviewed at a few clinics all over the country, and I ended up deciding on Denver, and my husband also got a really good job opportunity here. So my deciding factors for my job was definitely mentorship. Coming out of residency, I had a lot of great professors and mentors in residency. And so coming into the real world is never easy. You never want to be alone. You don't know everything. That's the mentality that I had, which is a good mentality to have because you're going to be collaborating a lot of cases with other professionals. And so I ended up finding Dr. Richardson. She was an amazing mentor. As soon as I spoke to her, we clicked and we just formed a great team. She's been in private practice for more than 10 years in the Denver area. So she really is a community leader, and she's very supportive in my growth at this moment. So the important factors to look for in an application before accepting a job, I would say definitely the contract language. You want to make sure that if you're not familiar with contract language, you have a lawyer or an attorney look over stuff for you so that you're not blindsided or confused. There is some sneaky language in certain contracts. So just make sure that is taken care of. You definitely want to go somewhere where there's growth opportunities. You never want to be stuck or feel like you don't have a way to grow in your company. So definitely look for growth opportunities as a private practice dentist or periodontist. Supportive team. You want a good solid team of hygienists, assistants, front desk, people that are there and love what they do. That helps you love what you do. Community service, I definitely wanted somewhere that took care of the community and was involved with the community. As you can see, my entire journey in dental school and college was always serving my community locally and abroad. And so this was something important for me. And leadership opportunities. This is my practice. This is Dr. Richardson. She started this practice maybe about 7 to 10 years ago, and she's built it up really nicely. And I'm just very happy to be somewhere where I can call home, and I have a really amazing team. So we have an Instagram too. We're trying to post most surgeries, mostly for patients and patient education. Community service is something we do a lot. We did just recently, a few weeks ago, we did Pop Up for Prevention. This was a suicide prevention event by the Rohr family. And it was a great turnout, 50 or plus people. We had amazing speakers, people that went through different situations that dealt with teenage suicide or suicide in general. And this was a really, really nice event. It kind of brought everyone together and enjoyed, some putt-putt. We are involved with the Integrated Family Community Services for food drives, especially around the holidays. This next week, we're collecting canned goods and perishable items to donate to food banks for families that are in need. We're part of a study club. SPEAR is one of the largest continuing education sources online. They have a location as well, but they have amazing support for every dental professional. So in this picture, we get together with some of the best dentists locally and prosthodontists, endodontists, orthodontists, and we come together and we chat about cases. We present tough cases. That's Dr. Shank holding an articulator with someone's impressions and their teeth. So we really kind of get everyone's brains together and try to help patients out formulating treatment plans and discussing cases. It's super helpful, and it's exactly what I wanted to be involved in. When I thought of, private practice, we do this once a month, and they bring in food, and our office actually hosts this study club once a month. So work-life balance is definitely important. Traveling for me is something that I've always wanted to do. Even if I was super busy, I always wanted to take time out to travel, make sure that's something that my husband and I do every year. We love the outdoors lifestyle here in Colorado. We do hiking every weekend. We've been to a lot of mountains. We have not done a 14er yet, but that's coming up. We have to make our way up. And my last pearls for pre-dental students would be persevere. Definitely don't give up. If you get a C in a course, don't feel like you're a failure. I got a C in Chem 2, and that never held me back. Just, think what you can do to improve that specific scenario in your life. I took analytical chem, which was a little more advanced, and I got an A. So I was able to show my resume that, Chem 2 was not a big deal. And I, in an interview where that came up, I was able to kind of discuss my improvement. So definitely don't let yourself down if you do make a mistake, or, feel like you're not good enough in certain areas in your resume. Network a lot, reach out to mentors, ask people what it's like to be in their shoes, and for advice. You guys can always reach out to me via email or Instagram. I'm always very responsive. Interview skills, definitely find a mock interview center and just go for it. Start talking about yourself, get comfortable with your resume. That's super important too. And surround yourself with like-minded individuals. If you have a few friends that are striving to go into pre-professional programs or advancing their education, definitely get a good study group going, because you're going to be staying in a lot of weekends studying, and it'll pay off. And don't give up. I'm going to show you some surgical videos now. This is a fun part. I'll explain what I'm showing. If you guys have questions, obviously at the end, you can ask me, but all the content that I'm presenting here is for educational purposes only. The consent was given by each patient to have their photos and videos displayed today for educational purposes, and all the content that I'm going to present to you was documented and edited by me. So this is one of my patients in residency. She came in with severe periodontal disease in the few teeth that she had left in her mouth. Some of the teeth that were part of a long span bridge had a lot of bone loss and infections, and basically a lot of cavities and decay underneath the bridge. So the patient needed a full arch treatment, which is removing the remaining teeth and giving her an implant supported denture. So on the lower left is after we took out all of her teeth and we put bone grafts on the sinus cavities, and as well as on the sockets where the teeth came out from. On the right is the end product. This is the temporary teeth that she's having as she heals. The little yellow holes you see is the access to the implants. So those are where the implants are at. And the panoramic on the lower is a little distorted because it's from a CT scan, but we were able to place 7 implants for her and do it through a surgical guide. The surgical guide is prefabricated according to how much bone density there is and where we'll place the implants. And so the day of surgery, it is very easy to place the implants in the ideal position. So I'm going to play this video. So this is just making access holes for the implants. We remove the tissue very carefully to be able to access the bone underneath. We're making little holes to secure the guide. So this surgical guide gets pinned into the patient's jaw or maxilla, and it does not move. So we're doing this flapless. We're not opening the gums. We're making very small holes to place the implants for this part. This is the beginning of the implant placement. So we'll start with very small drills and move to a wire drill. And always under irrigation. We want to make sure that we're not burning the bone, and always having suction for the patient to be comfortable. This part is when we have to open the gums because we did not have enough thickness of bone in this area to place implants. So we're doing an incision to be able to open the bone and be able to see underneath so that we can do bone graft plus an implant placement at the same time. So this is the bone that we have. As you can see, it's very thin. It's almost 4 millimeters thin. So what we're gonna do is split the bone. The maxilla is it's kind of like styrofoam versus the mandible is more like oak. So we're able to use this instrument that helps us separate the two pieces of bone, the buccal and lingual. This piezo-scission instrument is really cool. It can be used in different kinds of surgeries, specifically here. Now we're expanding the bone to give ourselves more width. This is called ridge splitting. This is a ridge splitting instrument. It is basically a chisel. And we're gently just tapping the bone, making sure there are no fractures. And we still use our surgical guide to be able to place the implant after we expand the bone under a lot of irrigation. This area, we had to do a small sinus lift. The canine area had a small area where the sinus was kind of too close to us. So we made a small access, and this is the sinus membrane moving up and down as the patient breathes. We have to do this in order to not perforate it if we want to place an implant in this area. This is a collagen membrane. This will help us protect the membrane and grow bone in this area. And we're just putting some bone grafting in this area. This is allograft, so this comes from a cadaver. There's small chips of bone that have been sterilized, sintered, and chemically treated. There are no live cells in it, but we use this to be able to grow bone, and it's the most predictable material that we use in my practice to be able to grow bone. This is us placing the implants in this area. As you can see, we now have enough room in the bone. We were able to split the bone and place the implants wedged in between the two bone plates. Here, we're just putting a collagen membrane over all the bone graft. And here, in order to close any incision, you need to have tension-free closure. So making sure that when the patient heals, if they swell up, the wound is not going to open. And so we have to sever some of the muscle attachments inside the gums to be able to have nice tension-free release. And we do this by using a blade, and I'm making sure that when I pull the patient's lip up, the flap, the gums are not moving up with it. And now we're just suturing everything in place. And I'm not putting much tension on my sutures. Everything is very, very tension-free, which is what you want. This is a continuous suture that we use to close long span incisions. And that was it. So this was a full arch treatment for this patient. She has her final prosthetic now. Case 2, I'm going to skip over this one because we're kind of running out of time and it's a little too bloody, I think. But we can come back for it next time. Case 3, this one's a little shorter. This is a soft tissue graft. So when patients have recession, like this patient, we're able to treat this recession with either connective tissue from their palate, or we can use alloderm. Alloderm is basically cadaver skin, and they use alloderm on burn victims. So it is widely used in the medical field as well. It's very nice to use when patients have really nice thick tissue that we can put the alloderm underneath. So I just made an incision with the blade, made sure I detached the gums from the bone. Now I'm putting this piece of alloderm tissue, synthetic skin, into the flap. And now I'm going to make sure that I bring that upwards so that it helps me thicken that tissue. And we're doing this flapless, so we're not opening the gums here. We're just making a tunneling incision, so separating the gums from the bone. And we're bringing the gums upwards with a suture called sling suturing. and the patient will have these sutures for about 3 to 4 weeks. And that's a tissue graft. I hope you guys enjoyed the presentation. I really am looking forward to answering some of your questions.
Okay. Oh my God. Thank you for that. I absolutely love videos like this. It's probably not the norm, but I thought those are
I
fast.
know. I think they're great to show to people who don't, typically see these surgeries. It's much better than pictures. And in residency, we had a lot of the really cool camera gear. So the camera that I used was a Sony cam, and we just attach it to the light and we capture a lot of our footage. It's a great learning experience too.
Yeah, I didn't even know like implant guides existed. Like whenever I seen implant procedure, it's kind of just like a one and done type thing. So I never knew
Yeah.
there was like guides that you could actually pin into people's.
Yeah, when you do full arch, so 6 implants or more, you want to make sure that all the implants are in the same direction. And so the only way to do that really is with a lot of experience, which I don't have a lot of experience, but I use surgical guides and we use the technology we have, and we are pretty darn close to being perfect at this point with the technology that we have.
That's amazing. Do you guys make the guards at a separate lab or is it like in?
Yeah, we work with a lab.
Mhm.
There are people that 3D print guides, but we worked with a lab. They're actually in Germany. It's called SciCat, and we merge the patient's denture with the bone in a CT scan, and then we plan where the implants will be, and then we tell them that we want how we want the guide, and then they make it for us and ship it to us.
That's crazy. Is that a long process or like a wait time in between?
Probably 2 weeks. I
Oh,
would say 9 days to 2 weeks. It's not very long. And the lab we worked with was very, very accurate. We rarely had to turn down guides, but they worked with, really good software, really, really good CT machines with really high definition. And so that's why we were able to provide really good results.
that's amazing. It's so cool. Okay.
Yeah, this is a part of Perio that's fun.
Mhm.
A lot of people are not able to experience this in dental school, obviously, because it requires a lot of training, and it's definitely fun to watch. So if you were able to shadow, if you're interested in Perio, I definitely
Now
implore
I am.
you.
Okay. And then on average, do like each of these procedures take like an hour, 2 hours?
So I would say in residency, it took a long time because I was still learning, and you're in the learning uh, environment. And so procedures could take 2 to 3 hours, and patients knew that. And patients were paying a lot less for the procedure, so they were more willing to go through that in the educational setting. But in private practice, you have to be a little bit faster. People have jobs, and they are relying on you to get them successful procedure with a good time frame. So I would say in general 1 to 2 hours in private practice for a case like this. In residency, that procedure specifically took me about 4 hours.
Mhm. And then oftentimes, do you use IV sedation on most of your patients, or it's kind of saved for those bigger cases?
Yeah, so it depends on the patient. I don't judge patients' anxiety level, even if it's a deep cleaning, because patients go through different traumatic experiences, especially as children,
Mhm.
and they don't want to even hear the sound of an instrument. And so I do IV sedation for patients who are basically getting just a normal cleaning, or patients that are doing a full arch case. So it really depends.
Mhm.
And I think getting good training in IV sedation and being able to handle cases with patients that have a complex medical history is super important. But it really depends, and the range of procedures we do under IV sedation really just depends on the patient's uh, amount of anxiety, fear, and medical history.
I see. Okay. Yeah. I work as an assistant, so I've never seen IV sedation at my office, but I know it's like common practice for like
That's
oral.
awesome. Yeah. It's so good to be in the dental field so early. I was an assistant between college and dental school,
Mhm.
and I was able to assist in endo and general practice as well. So it's really nice. You'll have a huge advantage when you are you in dental school, or sorry, are you applying to dental school?
I'm actually going to be applying this next cycle, so
Oh, fun. Good luck. Yeah.
thank you.
Awesome.
And then actually this like ties into like your master's degree. What do you mind sharing what you got your master's in specifically and how it like furthered your education or enhanced it?
Yeah, of course. So it's master's in science and science and dentistry specifically. So a lot of programs will have, you'll see a lot of specialists with the last name MS or MSD with the title and their last name. So MSD is just Masters of Science in Dentistry, which is what our Boston University offered, specifically doing a master's degree focused more in the dental field, because you can do a master's degree in if you study, lab rats or cell culturing and you're studying different chemicals or medications. But specifically, I wanted to do a master's in dentistry. And so I was able to apply what was I interested in. So in residency, I was really interested in immediate implants and kind of the how people got to the decision during a clinical assessment. And that's what led me to making a classification of when to decide to place an immediate implant in a premolar site and when to not. And this was, working with a mentor that had done immediate implants for a long time and had the experience and I was able to go through this database of CT scans that we had in our school that were already cleared for research. So it is quite a bit of a process because you do have to go through this process of IRB. It's basically a clearance so that patients' medical information gets exposed. And so because you're using patients' medical records, but ours was specifically for just studying scans. And so we had a clearance and none of the patients' name were attached to the scans. We were able to use that info to kind of view a lot of the information we needed to jot down for our assessment and classification. So it was about 3 years of research that I did. And it was not every day, once or twice a week in my week, I would dedicate a few hours to this project. And so it's nice that you have a lot of time to do that during clinical and during exams. And we have a lot of, different projects and presentations that we have to do in residency. So it's really busy. And if you're really interested in a project that you can do with a good mentor, I definitely don't see why not. But definitely be ready to write a lot because we did have to write a thesis and correct it. And I went through about 100 different drafts. So it's a lot of work, but it gives you something to kind of talk about. And also, it's a good learning experience. I don't think I would be as good at reading CT scans today if I didn't have that experience under my belt.
Sounds a little daunting, not gonna lie.
Yeah, I'd rather work with CT scans and imaging than animals. I don't see myself injecting lab rats or killing mice. And so a lot of my co-residents had the courage and the ability to do that. I was not a animal driven scientist. I did not want to go through that. I have a dog and I could not kill a thing. Like I'm the worst. I can't even kill a spider. So I think imaging for me was perfect and it helped me a lot today. So I don't regret it at all. Even though it's really, some days I was regretting it. I won't lie, but it's part of the process and you come out stronger and smarter at the end.
Yeah. And then you talked a lot about like scholarships or how you were you had a lot of scholarships. And I was just wondering, did you research that on your own or was it more like it was offered to you? Because
I researched that I researched both of those kind of on my own. And you have some school, what do you call them? Counselors that can help you find scholarships. But I sat in the computer and I would research these things for a long time. So this is one thing that I spend most time on was probably reading about programs and reading what each program offered and the different opportunities. And so for my program, I wanted a cutting edge program with a lot of technology. And it so happened they also offered a scholarship. And so all these things kind of, if you don't do the research and put in the time to look it up, you won't know because none of these things are offered to you like on a platter. You have to kind of be a go-getter and get yourself out there. And if you're interested in an opportunity or whether it's a scholarship or if it's an internship opportunity to shadow someone or you know, a small research program, all of these things, if you don't kind of show up and you're not a go-getter, the opportunity slips really quickly. So I would say definitely spend a lot of time doing research on the computer with scholarships, deadlines, different requirements. So that's probably one thing I dedicated a lot of my free time to as well.
Yeah, I've been trying to get on that too because the cost of the tuition for dental school is kind of scaring me as well. So any resource,
Definitely
like,
crazy to think about the amount of money that you have to invest.
mhm.
And it's getting, you know, it's increasing every year.
Yeah.
But you know, if you start looking at it in that sense, it can scare you and overwhelm you,
Mhm.
especially for being, you know, I personally didn't know anything about finances until now. I started reading a lot of finance books, and it's definitely an investment. And that's why I tell you, in order to be what you feel is successful, it should be something that comes from genuinely from your heart, like what kind of professional you want to be. Because if you get into a, you know, $500,000 loan with student loans, which is the average for dental schools, if you're not going to have any help, or you know, if you're relying on government loans, then you really got to think twice about what you're doing, because um, government student loans, you know, something you have to pay back, and you have to be really good about your finances in residency and in dental school, living like a student, and you know, living humbly. But it's, I would say, it's something that if you know for sure in your heart that you want to be a dentist, then this should not phase you, because there are ways to pay back. There are, you can sign up with the armed forces. You can sign up for public clinics where you work once or twice a week and they help you pay your loans back. And so there are ways to relieve debt, but everyone in dental school is going through this. And so no matter where you end up going, they'll have resources for you to kind of manage the debt and manage, you know, the burden in your head, because a lot of it is also mental stress that you're going to go through.
Yeah.
And you have to be mentally strong to get through dental school and come out feeling like, you know, it was worth it. But it will be worth it if you're already a dental assistant and you're seeing kind of your day-to-day life and you see yourself
Yeah.
in that position. Then I would say it's something that everyone goes through. And you know, fortunately, there are some aids and helps out there that will kind of help if you are looking into going into the armed forces, or they
I
do
have to pause,
provide
like, yeah.
scholarships, they do stipends. You serve the amount of years you give, you serve the amount of years you get.
Yeah.
I have a really good friend who did oral surgery, who's doing oral surgery now, and she got she's with the army, and she went, you know, 4 years with the army, served 1 year in Korea, and then she's in the oral surgery department serving the amount of years that she owes, but she's in residency. So it's really cool. Look into those programs if you're interested in residencies, because some of the armed forces, they let you go through residency and still that's still working, so you're still paying it back, but you're also specializing at the same time, which I think
Wow.
is really cool.
Yeah, I was actually looking into that myself, and I'm talking to a recruiter and everything, so I'm excited
That's
about that.
awesome.
Yeah.
Yeah, it's really cool.
Mhm.
I think it's definitely something that there should be more information
For sure.
about.
Mhm. Well, yeah, I don't want to take any of your time since the hour's nearly up, but thank you so much for that. And I'm sure everyone out there that's watching or
Thank
listening.
you guys for having me. This was really fun, and I congratulate all of you on, you know, pursuing and doing things differently and accommodating to today's craziness with the online platform. This is so cool. And when you guys reached out to me, I just thought it was such an amazing resource for other dental students. And so congratulations on your journey. I'm here if you guys have questions. Take a picture of this. My email's right there. I'm always responsive. If you need anything, just let me know.
Oh my God. Yeah, thank you so much for all of these resources and all the information. It was more than I thought today. Like, honestly,
I know I talk a lot.
it was so exciting. I loved it. Yeah.
Yay. See you guys soon. Take care. Good luck.